Hello everyone, myself Dr. Parth Goswami, and today I am going to teach you about the Acrokeratosis Verruciformis of Hopf, one of the topic from dermatopathology. It is very important for postgraduate students. So it is the rare dermatological disorder. So it's very rare and it is classically characterized by keratotic lesion on the dorsal aspect of hand and feet. So mainly it affects the hand, feet, ankle like that of area, and lesion is on dorsal surface. It is wart-like lesion. It's due to the mutation in ATP2A2 gene. Now, this Acrokeratosis verruciformis of Hopf is associated with diarrhea disease usually. So, diarrhea disease is one of the autosomal dominant skin disorder. Men and women are equally affected. So, there is no difference in the prevalence between men and women. And this lesion first identified by Dr. Gustav Hoff in 1931, after which the name Acrokeratosis verruciformis of Hopf is given. He was the German dermatologist. Now, what is the clinical presentation of this disorder? So, if we talk about the clinical presentation, then it is flat to top, skin colored papule or wart like lesion. So, it is papule or wart like lesion and it is flat top and the color is like that of skin. It usually occur on the back surface of the hand and feet. As we have discussed, on the dorsal surface it is seen. It is not seen in ventral aspect. Forehead, scalp, flexor area, and oral mucosa are not affected usually. This area usually sparse. They are usually not affected. All right. So that was a clinical presentation. See, in this particular image, you can see a wart-like lesion on the dorsal aspect of feet. It is flat top, elevated lesion, brown color. It looks like an wart, right? Now, if we talk about the histopathological finding of this disorder, means that is known as a photomicrograph. Then here is the classical histopathological presentation. Patient is, in biopsy we can see a hyperkeratosis. In a histopathological examination, the first finding is hyperkeratosis, excessive keratin formation. Another one is acanthosis, means epidermal thickness is increased. So acanthosis is also observed in this particular condition. Then after we can see a papillomatosis, papillary projection, epidermal elevation like papillomatosis. And there is a prominent granular layer. The skin is having various layer, right? Among that one layer is granular layer, so that will be prominent. Now due to epidermal elevation, here in this disorder characteristically church spire like elevation is seen, that we will see in photomicrograph. So that is the characteristic. Now we have a question, why ATP2A2 gene mutation causes this acrokeratosis verruciformis of Hopf and diarrhea disease as well. So why? So this particular gene encode a sarcoplasmic reticulum calcium ATPase to pump. So pump's sarcoplasmic reticulum is controlled by this gene, and this pump will control the intracellular calcium homeostasis. So if this gene is mutated, then pump is lose the control, and so the keratinocyte will not hold together. So that's the reason for this disorder. So this is the photomicrograph of Acrokeratosis verruciformis of Hopf. See, our first finding is stratified squamous epithelium with marked hyperkeratosis, excessive keratin, which you can see in this diagram. The second finding is acanthosis, means increased epidermal thickness. Third important finding you can see is papillomatosis, papillary like projection of epidermis, right? And here you can characteristically see that epidermal elevation is like that of church spire. So church spire like elevation is seen in the epidermis. So that is the characteristic important finding for the diagnosis of this particular disorder. So these three important finding is seen in this photomicrograph: hyperkeratosis, acanthosis, and church spire. Now here in this diagram, I want to show that there is a prominent granular layer. So you can see that the granular layer is very prominent in the epidermis, and very scanty superficial dermis perivascular inflammation is noted. So this is all about the Acrokeratosis Verruciformis of Hopf. I hope you have enjoyed this particular video. We will be right back with a new video. Till then, take care and bye bye, guys. Thank you very much. Thanks.